So thanks, Brad. We are really fortunate that we are seeing many fewer cases now than we were seeing at the end of last year and in January. So as Brad said, only 9 inpatients right now in the hospital. That is way, way better than what we had January, when things were really overwhelming for the health system overall. However, we are starting to see a little bit of an uptick in cases, and this is not unique to Nebraska. This has been something that's been occurring nationwide. Cases in Lancaster County have been rising now for the last 6 weeks. There is really only one primary variant circulating right now, and that is the Omicron, specifically the BA.2 subvariant. This is a highly infectious form of COVID-19. So people who are not vaccinated are particularly vulnerable to that. We are starting to see a number of increases in employee absences due to COVID-19 illness. So once again, this virus is making it harder for us and others to care for patients when people get sick and get excluded from work. The good news is that the vaccines that have been around and continue to be around and available really provide excellent protection. And the main things is that they prevent significant risk of dying. The risk of dying is much less if you've had the vaccine, and the risk of an ICU admission is much less than if you've had the vaccine. And this is the same thing that we see with influenza vaccine. A lot of people will say, well, I got my flu shot and I got the flu, so what's the point? Well, the point is that you didn't end up in the ICU or dead, and that's the main benefit of this particular vaccine. So I would just strongly encourage people who have not been vaccinated to think about getting vaccinated. Please ask your neighbors, your family that have had the vaccine, how did it go? And there are some occasional side effects, but overall this is a very, very safe vaccine, very well tolerated vaccine. If you have friends or family that you know have not been vaccinated, please consider reaching out to those individuals and just letting them know that you had a good experience with the vaccine, assuming you did, and encourage them to get the vaccine. One of the points that's been made on some of the calls I've been on is that there are parts of our state and other parts of the country too that are particularly vulnerable to significant surges, and those are areas of the state where vaccine uptake has been extremely low. And it's certainly understandable that people are cautious about accepting of new vaccines, but the data that we have seen month after month after month now is that if you have not been vaccinated, those are the individuals that are going to end up in the ICU and potentially dead. And we have seen enough death from COVID-19. It's been a little while since I've seen a death from COVID-19. I did see one just a few weeks ago, but boy, back in January, I saw multiple 30-year-olds die, and that's something I really never want to see again. It's not something that should have happened if those individuals had been vaccinated. If you are over 50, please consider getting a booster vaccine. If you have not had the primary vaccine series, please consider doing that. Vaccines are widely available. If you have friends or family that may have been a little bit hesitant about getting the vaccine and you've had a good experience with the vaccine, please share that with them and help encourage them to make a choice that will help protect their livelihood.